Wellness Programs Manager for Carilion. And I am happy that you're here with us today. I know this is a very busy time of year. Everybody's trying to wrap up 2025, but we have a wonderful speaker for you today. And before I introduce her, I just want to let you know about some things that you may have noticed as you were waiting for the presentation to begin. Of course, today's webinar is all about diabetes as we are celebrating National Diabetes Month. Our final step challenge of 2025 begins December 1st and registration opens on November 21st. So if you haven't already seen an email or seen a notification through Personify Health, you will be getting that soon. So this is your last chance to get in some steps and earn some points for 2025. We are working together with the Blood Connection on December 4th. It's a Thursday at Carilion Memorial Hospital. The blood drive will be held in the 6th floor auditorium from 10 a.m. to 5 p.m. So in addition to earning $40 in rewards for donating, you'll also earn 200 Personify Health points. So just, again, another way to get those points up. And then I also want you to mark your calendar for December 18th. We have an exciting webinar, something a little bit different. Deb Farron will be telling us how to supercharge our communication skills. So that should be a very interesting presentation. All right, I am going to stop sharing my screen now and introduce Kate Jones. Kate is, I'm still sharing, let's see. I've had the privilege of working with Kate for many years, knowing her both personally and professionally. And I can tell you that she is a wonderful person and an amazing educator. Kate actually serves as the practice supervisor for the Carilion Diabetes Management and Prevention Center. And I'm going to invite her to start sharing her screens at this point.
Thank you so much, Julie, for that very generous introduction. I was trying to think how far we go back and if it was the event when I was pregnant many years ago with Dr. Bailey, but so it's been at least 13 years, I think.
Yes, it has. Long time.
So thanks for having me. I am very informal, gang. So if you have any questions as we go along, please don't hesitate to stop me and ask. If you want to hold questions to the end, that's fine. I can't really present and watch the chat at the same time. So if something comes into the chat, Julie, feel free to stop me and holler.
Yeah, and Kate, that's a good point because I will typically at the end of the presentation go through the chat and ask questions. So that works great.
Sounds good. Okay. Let's get into presentation mode here, guys. Okay, everybody see my screen okay?
Yes.
Okay, thank you. All right, so Julie has already identified our objectives for today, but you might want to have a pencil and paper ready if you'd like to assess your risk for type 2 diabetes. We will be doing a risk test a little bit later on, but we'll look at the risk for developing type 2 diabetes, things that we can do to at least delay, if not prevent, type 2 diabetes. And then for those already living with diabetes, understand what we can do to better manage that. So a couple stats just to start off so we have some context. Currently in the US, 38 million Americans are living with diabetes. And so that's about 1 in every 10 people. And that's concerning enough, but I think more concerning is that 1 in 5 of them don't know that they have it. When blood sugar is elevated, we don't necessarily feel that even when it's in the diabetes range. And we'll talk more about those symptoms momentarily. With prediabetes, even more folks, so 98 million American adults have prediabetes, meaning blood sugar is higher than it should be, but not quite high enough to be diagnostic for diabetes. So that's more than 8 in 10 Americans with prediabetes, or that don't know that they have it, excuse me. So even lower blood sugar than with diabetes, we just don't feel those symptoms. So unless you're going for regular checkups, you might not have a clue that you're walking around with prediabetes. So, what are some of the symptoms of high blood sugar? If you might not have any, but if blood sugar is high enough, you might notice that you're drinking more, um, and then having to go to the bathroom more. Maybe you're feeling hungrier than usual, like can't quite seem to fill up. Maybe your vision is blurry. I know that when my dad was diagnosed several years ago, I was in high school and he had gotten to a point where he couldn't see. I played sports and he couldn't see who we were on the court. He couldn't distinguish who my teammates were. So he knew something was up when his vision was blurry. Or maybe you have some cuts that are slow to heal, or just really feeling tired all the time. That's probably the thing I hear the most. People are just feeling really fatigued, lethargic, and that's their clue that something's not quite right. So normal glucose metabolism. I think it helps to kind of understand how this works, so then we can understand what's not quite working right with the various types of diabetes. So the way things are supposed to work when we consume food, especially foods with carbohydrates, is that carbohydrate breaks down into glucose or sugar in our bodies, and that travels through the GI tract into the bloodstream to the cell. And when we consume that food, the pancreas is releasing insulin. Insulin is a hormone that will basically unlock the door to the cell so that that glucose or sugar can get out of the bloodstream and into the cell where we can actually use it for energy. So this is what's supposed to happen when things are working normally. The issue is that, and this is where I would normally ask you if you know the difference between type 1 and type 2. Many people think that it's age, but actually the difference is it, type 1 is an insulin production problem and type 2 is an insulin utilization problem. So in type 1, which can develop at any age, the body is just not making enough insulin. So we don't know exactly what causes it, so we don't know how to prevent this, but it's an autoimmune disease. And for whatever reason, something's attacking the cells in our pancreas that are supposed to be making that insulin, and it destroys the body's ability to make insulin. This accounts for about 5 to 10% of all diabetes cases. So the more common type is type 2. 90 to 95% of folks with diabetes have type 2 diabetes. And again, this is an insulin utilization problem. So the body is still making insulin, the body is just not quite using it properly. This is what we'll spend most of our time focusing on because this is the type that we can, again, at least delay, if not prevent. Type 1, we are actually getting more screening tools for that, so that might be a separate discussion. But type 2 has more of a lifestyle component that we can work with for prevention. Okay, so what does it matter with diabetes? Why is this a big deal? So if probably everyone on this call knows somebody with diabetes, or maybe you're living it with your living with it yourself. There are unfortunately many things that can result from having long-term high blood sugars, and those are the things we're trying to prevent. So that's why we want to catch this as early as possible and manage it as well as possible. So basically, anywhere that there's blood flow can be affected by diabetes or high blood sugar. So it can affect our eyes, our kidneys, our heart. We have a higher risk for stroke or heart attack. And then, we want to really hang on to any places with those small blood vessels, toes, feet, legs, and avoid amputations. And medical costs can really skyrocket for folks with diabetes. So there's all kinds of meters and monitors and medications, things that can really add up from a cost perspective. So what are those risk factors for type 2 diabetes? So there are several things we cannot control. Like we can't pick our parents, and family history plays a big role. We can't change our age, and race even plays a role too. So we have no control over any of those factors. What we do have control over to an extent is our weight and our activity level. But it's all of these things that come together to kind of create the perfect storm for type 2 diabetes and increase our risk. Okay, here's where your paper and pencil come in handy. So I will read through the questions. We'll give everybody kind of a second to think through and answer the question for yourself. So, and then you can score this yourself at the end and see what your risk is. So, age. If you are younger than 40, you don't get any points. If you're between the ages of 40 and 49, that's 1 point. 50 to 59, 2 points. And if you're 60 years or older, 3 points. You get 1 point for being a man. Sorry, guys. 0 points for being a woman. If you are a woman and have ever been diagnosed with gestational diabetes, that's a point. If you have a mother, father, sister, or brother, an immediate family member with diabetes, that's a point. If you've ever been diagnosed with high blood pressure, that's a point. If you are not physically active, and I know that that is kind of subjective, but try to be as objective as possible. If you're not physically active, that's a point. And then we're going to use this chart on the right to determine weight category. So if you can find your height and then follow that across to the right till you find your weight range, and then follow that all the way down to the bottom, it will tell you the points, 1, 2, or 3 points, depending on your weight category. Okay, so hopefully everybody's with me. If you scored 5 points or higher, then you are at increased risk for either having prediabetes or developing type 2 diabetes. And so would just recommend, if you're not already having regular wellness visits, that you schedule an appointment with your doctor to talk with them and run some labs. They'll typically run a fasting glucose, but it would also be advantageous to check a hemoglobin A1C is another lab value that can give you some more information. Okay, thanks for taking a moment to assess your risk for type 2 diabetes. So if you do go to the doctor and have lab work done, this might help you make sense of some of the numbers. So if your fasting blood sugar is below 100, that's great. That's where we want it to be. If you happen to have a glucose tolerance test, which is pretty rare unless you're pregnant, or you have a random glucose taken, maybe you weren't fasting, then 140 or below is a normal glucose range, and an A1C below 7. The prediabetes ranges would be from 5.7 to 6.4% for an A1C, a fasting blood sugar from 100 to 125, or a random blood sugar between 140 and 199. And then anything above that would indicate overt diabetes. So 6.5 or higher A1C, a fasting blood sugar 126 or higher, or a random glucose 200 or higher. All right, but again, the good news, we can prevent or at least delay type 2 diabetes. So we are looking at meals and movement primarily here. One of the things that is a great place to start from a nutrition standpoint is if you are a sugar sweetened beverage fan. This is kind of low-hanging fruit. If you're able to make some adjustments here, you can save yourself a lot of extra calories and carbohydrates. It's not that sugar sweetened beverages in and of themselves cause diabetes, but if they're part of an overall dietary pattern that's maybe just really high in sugar, then they're contributing to developing type 2 diabetes. So if you can see the teaspoons of sugar that are in each of these drinks. So if you're a sugar sweetened beverage fan, water's always your best bet. But if I had a nickel for every time someone said, I just don't like water, I might be retired by now. So um, I know there's a lot of controversy about artificial sweeteners. That's beyond the scope of today's session, but I would say that if you don't like water, then something that is sugar-free or diet would be a better option over a full sugar beverage. Okay, for meals, you might have heard of the plate method. This is one way to think about planning your meals so that we're getting a good variety of foods and not too much of any one thing. So always the focus is on eating more what we call non-starchy vegetables. So there's a place for potatoes and corn and peas and beans, and we can definitely work those in, but all the other vegetables are considered non-starchy vegetables. And those are the things that are naturally low in both calories and carbohydrates and can help with weight management. So filling half the plate with those is a really good strategy. That might be something to keep in mind as we're sliding into holiday season is if you have anything to do with the meal planning, maybe try to ensure that there are some non-starchy vegetables on the table. And then maybe a quarter of the plate has something starchy and a quarter of the plate has some sort of protein. So that could be chicken or fish or even eggs or nuts, nut butters, any variety of things that would provide a protein source that can help with that feeling of fullness or satiety that we feel at the end of the meal. So it's not that carbohydrates are bad. So that top right corner with the carbohydrates, starchy things like bread, cereal, rice, pasta, fruits, dairy products, they're not inherently bad foods. We're just trying to avoid having a plate full of potatoes and corn and beans, and that's the meal. So just trying to have a good variety and lots of color on the plate. It can help ensure that you have a good variety in all your meals if you're taking a moment to plan them. So I don't know about you, but if our family didn't have a plan for the week and then shop accordingly, we would really be scrambling during the week and using up a lot of valuable time trying to figure out what to put together for meals every time dinner rolls around. So if you can invest some time early in the week to think about what are you going to have for your meals, breakfast, lunch, and dinner throughout the week, and grocery shop accordingly, it will make your week go by a lot more smoothly and help ensure healthier choices if you're ready to make some changes. An app and website that has some healthy recipes on it. We recommend this a lot for people with diabetes, but just so you know, there's no such thing as a diabetic diet. So whether you have diabetes or not, you can find a lot of healthy recipes from this website. So the American Diabetes Association is a wealth of all kinds of information about diabetes, but it also has the specific diabetes food hub, and you can search all kinds of recipes. So whether you're looking for breakfast ideas, dinner ideas, cooking on a budget, or kid-friendly foods, this has all sorts of options. And one of the things I like about this site too is that if you have an ingredient that you're trying to figure out what to do with, you can type that in and it will show you a bunch of recipes related to that ingredient. So it can be really helpful with your meal planning. So that's meals. Movement. Um, moving more is helpful. So the bottom line is start where you are and try to build on that. We know that physical activity does all kinds of things for us. You know, if we could bottle this, it would help us with so many things. But, you know, I would challenge you to think of a time that you maybe were physically active and then regretted doing that and didn't feel better after you did it. So it can be a good mood booster, can help with focus, stress reduction, and sleep. And how much do we need? At least 150 minutes a week is what we're aiming for. Again, start where you are. If you're not doing anything for physical activity currently, just get out and go for a walk for 5 minutes. do what you can. It doesn't need to be anything monumental. But trying to build up to the 150 minutes a week or 30 minutes most days. And then ideally, if you can build in some muscle strengthening activity or resistance activity a couple of days a week. And that can be something that uses your own body weight. It can be something with actual weights or machines, but anything that challenges your muscles and makes them work harder than usual is what we're aiming for here. Okay, and how do we know the difference between the moderate intensity or vigorous intensity? So if you're able to have a conversation pretty easily, that's moderate intensity. And if you're struggling to talk while you're active, then that's more vigorous activity. So, and in case you missed it, 75 minutes a week of vigorous intensity activity would be another recommendation. Okay, so the activity does all kinds of things for us. Again, we take medicine to manage blood pressure. There are medicines to help us with weight. But being active, even a modest weight loss of 5 to 10% can help us with all these things, lowering our risk of type 2 diabetes and helping with blood pressure. Okay. Some of you may or may not have heard of the kind of the seminal diabetes prevention program, the study that was run in the early 2000s that showed that the things we just talked about, 150 minutes of physical activity a week and a modest weight reduction, just 5 to 7% weight loss, cut risk in half for the development of type 2 diabetes. And that is compared to a 31% risk reduction for people who were on medication only and not in the intensive lifestyle group. So, lifestyle management more effective than medication in this study for reducing the risk for type 2 diabetes. On the flip side, if no changes are made with lifestyle, then 15 to 30% of people with prediabetes will go on to develop type 2 diabetes within 5 years. So getting started sooner than later can really help slow that down or prevent it altogether, ideally. There is a formal diabetes prevention program. And we're going to talk about some options for that if that's something that you're interested in. But if you know that you have prediabetes, then this is something you might be eligible for. So if you're at least 18, if you're carrying extra weight, BMI over 25, you've never had an official diagnosis of type 1 or type 2, and you're not currently pregnant, and you have a blood test that indicates prediabetes, or you've ever had gestational diabetes, then you could be eligible to participate in a formal diabetes prevention program. So Carilion, our team has a diabetes prevention program. We're recognized by the CDC, which just means that we've met the criteria to the stringent criteria to actually meet recognition requirements. We are getting ready to launch another program in January. So this is an intensive year-long program. So it is a significant commitment, but it'll run January, probably through early January 2027. And initially the sessions are weekly, and then every other month for months 5 and 6, and then monthly for months 7 through 12. The sessions are an hour. They're in person. We meet here in our main office at 1231 South Jefferson Street. You may or may not know, we used to be in the Black Glass building, the Jefferson Plaza, which is no longer a Black Glass building. But we have moved down the street to this address right on the corner of Walnut and Jefferson. So if that's something that appeals to you or you have any other questions, please give us a call. Our number's there, 540-224-4360. If in-person is not feasible for you, the Virginia Cooperative Extension does have a diabetes prevention program as well. Theirs is virtual, and I can send these flyers to Julie to disseminate to the group, but you can get more information from them by accessing their website. And I think they're looking to launch another program by early 2026 as well. Or you can meet with one of our registered dietitians. Not everybody in this photo is a registered dietitian, but this was from our team building activity last year at Feeding Southwest Virginia. So this is our whole team. And so you could meet with one of us just one-on-one to have kind of a personal in-depth discussion about lifestyle changes and helping to guide that to help reduce your risk of type 2. So for any of the Carillion options, we would just need a referral from your provider if you know that's something that you're interested in. Okay, if you already know that you have diabetes, really the same things we just talked about apply. So we want to look at making healthier food choices, moving more, and then we just add maybe medications. This is kind of a really complicated slide, but the whole idea of this is just to say there are many different areas of the body that are impacted by type 2 diabetes. And so sometimes people wonder why they're on multiple different medications to help manage that. And that's just because there's no single medicine that can address all 8 of these areas in the body. So some of them do have multiple benefits. You'll notice that the GLP-1, GIP agonists, things like Ozempic, Trulicity, Mounjaro in particular, these work on a lot of different areas of the body, and that's why they're really effective at helping not only to lower blood sugar, but to help with weight management, as well as some cardiovascular benefits as well. So diabetes management, we're looking at meals, movement, meds, and then monitoring. So how are all of those things working together to help keep blood sugar in range? So we might use a blood glucose meter like what you see in this picture, where you have to poke your finger and then put blood on a strip to see what your blood sugar is. Or probably many of you are familiar, or maybe even wearing a continuous glucose monitor. This is a Libre sensor. There are Dexcom sensors. They are even available over the counter now. So even if you don't have diabetes, and so insurance probably won't cover a continuous glucose monitor for you, you can obtain these over the counter now. Dexcom Stelo in particular is something you can order online if that's something you're interested in. And then again, our team. So we are all certified diabetes care and education specialists. This is our team in front of the Jefferson Plaza, RIP Jefferson Plaza, a couple years ago at our holiday party. And so most of us are registered dietitians. So we all can get into nutrition. We all cover the gamut for diabetes management, but we'd be happy to meet with you for diabetes prevention or management, whatever the case. Here is where we operate. So we have our main office here at 1231 South Jefferson Street. We also see folks in the adult endocrinology office at Riverside 3 and Peds Endo at Tanglewood. That we have a site at the Franklin Memorial Hospital. We have an educator in New River Valley. We go to Giles, and there's an educator in Rockbridge as well. So just wherever you are, we can meet you where you are, and then there's telehealth available as well. Okay, so just to sum up, really important to just know what your risk is for developing type 2 diabetes. So if you don't already have diabetes and you're not sure where you stand, think about that risk test, and if you need to maybe schedule an appointment with your provider to have some lab work done and see where things are. And that ideally would be repeated annually. But type 2 diabetes can be delayed, possibly prevented, with a focus on meals and movement and modest weight management. And if you already have diabetes, that can be managed as well. And to be clear, I'm not saying it's easy, but we're still just focused on meals and movement, but with maybe some meds and some monitoring to see how all that's working. So hopefully you know some resources now for helping to manage prediabetes or diabetes, and we're here to help. So with that, let me know what questions or comments you have. Thank you.
Thank you so much, Kate. So I see a question about the slide where you show the drinks. Somebody said that they were told they needed to replace their electrolytes if they drink a lot of water. And she had a question about that one. And while you're looking for that, I just want to let everybody know that we got lots of requests to share the slides, and I'll be happy to do that with Kate's permission, as well as the other resources that she has shared. And I'll let you go ahead and talk about this one before I
Sure.
continue.
And yeah, and just so I'm clear, since I'm not in presentation mode anymore and my screens are moving around, are you seeing the drink slide or are you seeing my
Yes.
team slide? Okay, good.
Yeah.
Um, so I only drink water, but I was told water flush out your electrolytes to drink Gatorade every once in a while, but it had to, yeah. Lisa, unless there's some specific reason to be concerned about your electrolytes, um, there's no medical need to drink Gatorade. People who are very active, athletes or people who work outside maybe in summer and are sweating a lot, like that's who needs to really be sure to replace electrolytes. But otherwise, water as your primary beverage or even exclusive beverage is perfectly fine. Hopefully that answers that question.
Thank you so much. There's another question here. It looks like somebody has family with type 1 and type 2 diabetes. Oh, desk comment. Sorry, great presentation. I'm seeing a lot of that. Thank you. Great
Thanks, Lexi.
presentation.
Yeah.
Annette wants to know if you have type 2 diabetes or pre-diabetes, can you heal it with lifestyle changes?
Yeah, and I appreciate that. So I wouldn't use the word heal. There is the possibility of what we call remission, if somebody already has diabetes. So we've discussed with prediabetes, that can be reversed. But with type 2 diabetes, it's not that it necessarily goes away, but it can be managed to a point where possibly somebody doesn't need medication to manage it. So maybe they're diagnosed, they start some medicine, they initiate lots of lifestyle changes, and then end up not needing the medicine. That can happen. It's not a given. Um, and so if somebody is able to stay off of medicine with a diabetes diagnosis, then we can for 3 months, 3 or 6 months, I have to fact check myself, but then we call that remission. The other case would be sometimes people have gastric bypass surgery, and even before there's any change in weight, there's such an impact on hormones that the blood sugar can resolve after gastric bypass surgery. So sometimes that happens as well. So hopefully that answers your question, Annette.
Thank you, Kate.
Sure.
Another question, can we reach out directly to one of the dietitians at Carilion, or do you have to have a referral for that?
So, and again, just to be clear, so there's our diabetes management team, and then there's the nutrition services team, and we are all mostly made up of dietitians, so I know that that can be confusing. But for anybody with prediabetes or diabetes, a referral to Carillion's diabetes management and prevention team would be appropriate. If prediabetes or diabetes are not one of your diagnoses or not the thing you want to talk about, then a referral to the nutrition service team would be more appropriate. So I would encourage you to just have your doctor send us a referral, and then we will call you to schedule an appointment with one of our registered dietitians.
Great. And there's a question about type 3 diabetes. It just says, what about type 3 diabetes?
Yeah. Are you thinking about like when there's insulin resistant, like we've got components of both type 1 and type 2, Janice? So there's insulin resistance and an insulin production problem. I'm not sure if you mean like LADA, latent autoimmune diabetes in adults. There are many other types of diabetes. Type 1 and type 2 are just the most common types. Um, but yes, there are some other types of diabetes that present a little bit differently. And so sometimes testing is needed. So different lab tests, more than just glucose and A1C, are needed to determine what exact type of diabetes are we working with. So the provider knows what type of medications to use because some are not appropriate for certain types of diabetes. Michelle, thanks. You're the best.
Um,
Oh, continuous glucose monitor over
yeah.
the counter. Right now, Dexcom Stelo is the only one I know that's available. It does need to be ordered online. I don't believe that it's carried in pharmacies just yet. But you can look up Dexcom Stelo. They have a program where I think you can pay for a sensor over the counter for it's like 89-ish dollars, or you can like subscribe to get sensors on a regular basis, and that shaves a little bit off the cost. But it's somewhere in that ballpark, and you can look up Dexcom Stelo, Stelo. Thanks,
Great.
Lisa.
I don't see any more questions, but we have so many other ways that Carillion Wellness at Work can support you. If you're interested in managing your weight, if you're interested in learning more about how to prevent your prediabetes into becoming full-blown diabetes, I want to invite you to use that Personify Health app there. You can choose through the app and your topics of interest that you're interested in learning more about diabetes, and you'll see that information in your daily cards. There are also journeys that you can take about managing diabetes or preventing diabetes. But I also want to remind you, if you're using Weight Watchers for free through Personify Health, you can change your settings so that you can toggle onto the diabetes setting. And the way you do that is, just wrote it down here, and go into your program settings in your app in Weight Watchers and choose diabetes. And it will tailor your points and your foods to eating to manage your diabetes. So lots of resources here to share with you. I will share that Weight Watchers information when I send you your Personify Health code, as well as all this other great information that Kate has shared with us today. And I see one more question. Somebody's heard there's a podcast that correlates diabetes and memory problems like dementia or Alzheimer's. Is this a true concern?
Yeah, and I'm sorry, I just realized my camera's been off this whole time. But yes, there is a correlation. And Genia, if I'm pronouncing your name correctly, I don't want to misspeak on it is a little bit of a chicken and an egg situation. But yes, there is a correlation between elevated blood sugar and memory issues. So just another reason to try to get blood sugar down into a safer range.
And Maria, thank you for sharing that. If you use Personify and you shop in the Personify Health store, it looks like that you can choose a blood glucose monitor as one of your rewards. So that's great. Thank you, Maria. I don't see any more questions. Kate, thank you so very much. That was so helpful. And I think especially going into this time of year, not that it's not important to remember all the time, but we, again, just need these reminders. And I want to remind you also of all the other ways that Wellness at Work can support you on this journey. So I will be sharing all this information with you all in the next few days. And I wish you all a very happy Thanksgiving.
Thank you so much, Julie, for having me. And I
Yeah.
do just want to address Cheryl's question with the year-long prediabetes program. They're not mutually exclusive. So if you're interested in any of the programs that Julie described, in addition to the diabetes prevention program, as long as you're not overwhelmed, you can certainly do those concurrently. I would take advantage of all the resources at your fingertips to try to take charge of your health. So Okay. Thank you so much again.
Okay,
Have a great
thanks
day,
to
everybody.
you. Have a great afternoon.